I think first is to be successful on the internet, it takes a lot of commitment. It takes commitment and great people that know how to build these solutions. It takes a lot of financial resources because, as I mentioned earlier, these sites have to have utility. And so, and they need a strategy, and it needs to come from the top down that says, how do I share care? How do I put accurate and relevant health information out on the web? The days of the destination site are over, right? You have to go where the consumers are at, and you need to humanize it. That's why there's 1.7 million blogs that will be written today. Then they have to say, I need to go beyond just giving information. I have to inspire these patients to take action. And I have a lot of expertise, and maybe it's heart disease or cancer or whatever it may be. What are the programs that I need to put online that I can start to put these people in? Same the way I think about it offline today. And then ultimately, in that support layer, is how do I match that consumer to the right provider? And it might be patients that I'm already treating for today, or it might be patients that are online in scale, kind of looking for help. But I think this whole fragmentation problem that we've experienced on the web and health over the last 10 years, really has to change if we're going to have impact. And I think it's taking a lot of these trusted health brands and saying, look, let's work together. My website's not very good. I don't even really know who's doing my Facebook or my Twitter. But, how can all boats rise together, right? And I think Facebook has really shown that, right? As being an enabler and bringing all these brands and people together in one place. There's more to do. There's more utility. We get better results, and we get better commitment from the brands, the trusted brands, as well as from the users.
Yeah, and when I think of what do companies need to think about, what do organizations need to think about right now. If we have a conversation right now, it can be very productive, we understand each other, and we go and take action. When we go online, it should stay that simple. And so a company or organization really needs to say, how do I become a relevant peer? And you become a relevant peer by knowing who to speak with, influencers, using the language that they use so you actually connect, knowing where they hang out, because they don't necessarily all want to come to your site. They want you to come to them. They want you to understand what information they want in terms of content. So if you calibrate to the communities that you're trying to reach, you can become a relevant peer, and you get as close to a conversation as you can get online. And that's where you start to have breakthroughs, I think.
And think about how hard it is to do this stuff. Imagine if you're actually treating dozens of patients every day. But just think the piece that WCG does, the analytical piece, of how difficult and how much time it takes to actually look across the entire web and say, first I'm going to look at reach. How many index pages are there in Google, and how many friends does this brand have or person on Facebook, or how many followers on Twitter. Then I have to measure engagement, right? Because it's not just about reach, am I engaging with these people? So I have to look at pages, inbound links to my index pages on Google. I have to look at likes and comments on Facebook. I have to look at retweets on Twitter. I then have to marry that up against a taxonomy that has 42,000 nodes and 400,000 different medical concepts. And then I got to make sense of it all. And I got to say, from all that data, here are the key influencers, and here's who influences them. I mean, that's a big undertaking on itself.